When kidneys can no longer clean the blood well enough, dialysis steps in to take over part of that work. Dialysis is a treatment, not a cure. It cleans the blood from outside the body, removing waste and extra fluid. It's most often needed when chronic kidney disease progresses to kidney failure, often from diabetes or high blood pressure. There are two main types: hemodialysis, which uses a machine and filter, and peritoneal dialysis, which uses your abdominal lining. In hemodialysis, blood flows through a filter called a dialyser. Sessions usually last around 4 hours, 3 times a week. Peritoneal dialysis is done at home. Sterile fluid flows into your abdomen, absorbs waste, and drains out through a soft catheter. Before starting hemodialysis, surgeons usually create an arteriovenous fistula in the forearm, the preferred long-term access. During a session, staff check weight and blood pressure, then connect you to the machine. Many people read, rest, or watch films. Diet matters more on dialysis. A renal dietitian helps balance fluid, potassium, phosphate, salt, and protein based on your blood tests. Common issues include low blood pressure, cramps, or access problems in hemodialysis, and peritonitis in peritoneal dialysis. For many patients, a kidney transplant offers better long-term outcomes. Dialysis and transplant are complementary paths, not opposing choices. Many people on dialysis continue working, traveling, and raising families. Home and overnight options offer more flexibility. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.